So, the topic that I wanted to address was human trafficking. I think it's one of the most understated issues in healthcare. It's something that we're not readily aware of. It's very similar to domestic violence. A lot of the signs and symptoms are, which we are semi trained on picking up on those, at least we should be. But the reason that I wanted to address human trafficking is it degrades a basic human right for worth and right to self-determination with inherent need for equality and advocacy for these individuals across the world. Certain laws that apply to human trafficking are the Trafficking Victims Protection Act of 2020, which includes the protection of labor and sex trafficking. Justice for Victims of Trafficking Act of 2015, which helps provide services and resources for victims. The Preventing Sex Trafficking and Strengthening Families Act of 2014 to reduce trafficking amongst foster care children. Unfortunately, this does happen. They are just predisposed to being vulnerable, especially as minors. Their brains are underdeveloped. They're not fully getting their thinking process down. It's a lot of those actions. They're like, oh, they're promising me, this better life. I'm not happy where I'm at. I'm gonna go here, and they're gonna give me so much better things. And then once they get into it, they're like, whoa, what did I sign up for? This is not what I wanted. So the importance of this, this is a worldwide topic. I feel like this is something that is very understated. It's something that we are not aware of. So we are going to go over a little chart here, which is human trafficking and how many victims have you treated. So this is specifically for healthcare providers. So this chart is on sex trafficking. 82% have had contact with healthcare providers at some point, either for general physical exam, treating STIs, or HIV testing. The average life expectancy for somebody within this line of modern day slavery is 7 years, just due to the circumstances that they're exposed to, such as violence, drugs, you name it. They can have 8 to 10 sexual partners a day. That's where you can get a lot of these STDs, STIs spreading around the community, which we don't want to see, unfortunately. But, it does happen. The majority of victims are women and children. Males can be affected as well. The annual income for sex trafficking per individual is about $80,000 per year. So that's money that's not going back into the economy. It's not even about money. That blows my mind that these poor individuals are being reduced to this. That's crazy. But 4.5 million are involved in sex trafficking worldwide. This is by the National Labor Organization. So that's a very sad thought to me. Supporters of the issue are the World Health Organization, also the ANA. They aim to ensure that nurses have the skill sets, proper identification, and referral for victims of human trafficking, and how to advocate and support through protection and prosecution of those involved. So my position on this is, I may not be an expert on this, but I feel like you're degrading somebody's basic human rights. It's not something I would wish upon anybody. I've watched documentaries on human trafficking, sex trafficking. Once you've seen what they've gone through, it's heartbreaking. It truly is. You don't know what they've gone through, and even just watching it, that only gives you a snap. But it's heartbreaking. It really is. It makes me want to cry. How would I advocate for this group without a voice? You can provide education to others and services. especially ER staff. That's where the majority of these patients end up at some point. As nurses, we have a unique position to pick up on these kind of patients when they come into the ER or any other aspect of healthcare, especially if they end up on a medical surgical unit for if they are being exposed to domestic violence, if they have broken bones, facial bruising, fractures. We really have the position to help these people out. So discussing key facts and figures, we're just going to go over some things that I think that are important, such as the signs, percentages, and the recommended steps to take. So according to the Cleveland Clinic, if somebody presents to the ED or any other unit, they may have a depressed mood or affects, some anxiety or panic attacks, frequent visits to the ED, signs of drug or alcohol abuse, lack of eye contact, lack of identification. So they might not be holding their own identification. Somebody might be holding that for them. Somebody might also be speaking for them. That's kind of the similarity between human trafficking and domestic violence. There's going to be somebody controlling them, and that's going to be one of those signs that, hey, something's not quite right here. And they might also have stories that are conflicting with their signs and symptoms. Something's not quite matching up. And you're like, something's not quite right here. You might need to get somebody else's opinion in on it. So grab your charge nurse, grab another nurse, and be like, hey, is this really what I'm seeing? I'm not sure. Am I going crazy, or is this really what I'm seeing? So the percentages, this is just human trafficking. The other one was sex trafficking. 87.7% have had contact with healthcare providers at some point, and then 63.3% have been seen in the emergency department. That, I was kind of mind blown at that, honestly. I didn't realize that many people had been exposed to being just that's crazy. I can't even believe that. That's from the health consequences of sex trafficking and their implication for identifying victims in the healthcare facilities. So the basic steps recommended by the National Human Trafficking Hotline are, so the steps that you need to take as a healthcare provider: you need to establish rapport, which we would do with any patient, recognize those red flags, which I briefly mentioned, secure privacy. If they are with somebody else, try to, get them separated from them, try to get them isolated so that you can talk to them, start with those open-ended questions. Hey, how are you? Can you tell me more about this? One of the stories that I read is they just started a basic conversation, and it ended up that their patient was involved in human trafficking. You take the time to listen to your patient, and you might find out more than you expected. So use your screening tools, properly administer it and interpret it. Get your safety plan going. That's kind of where, the domestic violence comes back in. We were taught the safety plan, get them to safety. And then follow your protocols for mandatory reporting. Every state's a little bit different, but it is one of those things that you do have to report. And then once you get all these steps going, get them the resources they need. That's the last step. So my targeted audience is healthcare employees. They are on the front line of this. They have a very unique capability of being able to get in contact and get them the resources that they need, as long as they are properly educated on how to do so. The consequences of not acting or acting. I feel that there's really one step in this, and that is to act. And I know sometimes your gut instinct tells you, you are seeing it, but then in the back of your mind, you're like, oh no, am I really seeing this? If you have a feeling that something isn't right, something probably isn't right, and you should act on it, but in a very discreet way, not to scare off your patient. The landscape / background of this is by the Human Trafficking Hotline. We're going to talk about the cases per state. These are just the top ones, which is California has had 749 cases reported from 2019, Texas 561, and then Ohio 229, Michigan 172, and Illinois 127. Indiana was not mentioned in the top ranking, but you have to think Ohio, Michigan, Illinois, those are all our bordering states. And especially since we are closer to the Ohio border, and if we're going to take Richmond, for instance, they're right off of 70. That's a main highway. If something were to go wrong, hospital's right there. It's easy access. I don't really see how there could be a counter argument to being educated on this topic. It's basically modern day slavery, and it's either choosing to know or not to know, and you can't turn a blind eye to this. It's happening, and fortunately it is, but we have to just be aware. I can't really see a counter argument to this. The stakeholders that this impacts, if you have somebody, whether it's the community, healthcare, they're going to need all kinds of resources. Could be social work, some kind of substance abuse program, rehabilitation services. The amount of people that it affects, you wouldn't just think about each person. If it's a child, family, healthcare worker. Imagine all the little branches that come off of that. So the impact on the community, as I was talking about earlier with the STIs and the STDs, that does get put into the community. So that's something you have to think about. If there's an increased in your community, like why? What's going on? Is it more than minors just not minors, but young adults having unprotected sex? Or is there something else going on behind this? Like, why is our community having an increase in these? So survivors often are getting treatment for mental illness and substance abuse disorders. So that's another way that it can be affected by the community. And then children are especially vulnerable, whether they are in foster care or not. That's the unfortunate thing that can happen. A lot of these children that do go missing can be abducted, and it may not be from foster care children. So that's another thing, going to the grocery store with mom or, a family and the child goes missing. Unfortunately, you do hear about that. The economic impact on human trafficking, the National Survivor Network found that 90% of the victims had been arrested, 42% were arrested more than 10 times, criminal records prevented 81.5% of respondents from obtaining employment, and 55.6% from getting housing. So that results in the inability to contribute back into society. You just have to think, they can't work and they don't have somewhere to live. So that is that's taking resources and putting it somewhere else. Not that they don't need them, but the economic impact of human trafficking, yes, it can truly affect those things. So recommendations for policy, I would implement annual training for ER staff and having mock drills for the ER. Having a fake patient placed in one of the bays, having a nurse, having those people come into contact with this patient and saying, can our providers recognize what's going on with this patient? Kind of like, we did with our disaster response. I think, doing drills like that is one of the best ways to learn, especially since now that we've gone through it. Continued education, that could be something worthwhile. There are resources out there for nurses to partake in, especially if you are a Ohio nurse, that could be something that could be done. Funding for this, I think it would be just minimal, besides time for the training. It really wouldn't take much. The specific action that I would want anyone to take. So, if you encountered somebody possibly exposed to human trafficking, what steps would you take to ensure their safety? And then how would you feel if you didn't act upon your gut instinct that something was wrong?